Assalamu alaikum to everyone. I'm Malik Shahid. Welcome to this short video. Look, we know the exam is only some minutes or hours away. Uh, we have zero time to waste and everything to gain. So let's take a deep breath and we'll quickly master these concepts together. Okay, and I'm putting a disclaimer that I'm not going in details. Okay, of any topics that I mentioned here. Okay, I'll be talking superficially. Okay, so that we'll you know uh, finish it as quickly as possible and as so that we'll pass the exam. Okay, so as you can see the topics that I have mentioned here, these are the topics I'll be talking about. So we have four topics that we'll be talking about. We have the hypothermia and the congestion. Okay, and then we are going to talk about the edema. Okay, we are going to talk about now then the edema, then fever we are going to talk about the mechanisms, we are going to talk about the pathogenesis and the regulation of the fever, then rheumatic fever and the rheumatic heart disease. And in the fever there are two important terms that we should know, that is the hypothermia and the fever. Okay, the difference between the two. And in the congestion we are going to talk about the chronic venous congestion of the lungs and the chronic venous congestion of the liver and the spleen. Okay, so with this we are going to start with the name of Allah. Okay, so here we go. So first of all, we have this hyperthermia and congestion. Okay, we have this hyperthermia and the congestion. See, what is the what is the commonality and what is the difference? See, hyperthermia and congestion both both are what? The accumulation of the blood inside the organ. Okay, accumulation of blood inside the organ. Okay, for example, if this is the organ, if the blood accumulates here, that is hyperthermia and congestion. No, but there's a difference. Okay, accumulation is in both the cases, but if there is artery dilation is there, for example, if any artery is supplying this organ. Okay, if any artery is supplying to this organ, these are the arteries, for example. Okay, and this is blood going or traveling through these arteries. We know that in the artery there is what? Oxygenated blood is there. Okay, or we can say the pure blood is there. So the pure blood goes to the what? Organs. Now if there is a dilation, if there is dilation to the artery, for example, this is the dilation to the artery, can't we say the more blood will come or the more blood will accumulate here? When the more blood is here or it will accumulate here, obviously the more blood will go to the organs like this. The more blood will go to the organs like this. Okay, so when there is artery dilation, then there is the accumulation of the blood. That is what we called as the hyperemia. So what is now hyperemia? Hyperemia is the uh, accumulation or the deposition of the blood inside the organ because of the arterial dilation. Now what are the various causes of the arterial dilation? I will not go into that. I already told you I'm going to only superficially talking about these topics. Okay, so oxygenated blood, there's a dilation, artery dilation, and because of this arterial dilation, the oxygenated or the pure blood comes inside the organ and accumulates here. Okay, now is this is called as the hyperemia. So hyperemia is the accumulation of the blood inside the organ because of the arterial dilation. It's an active process, and remember that we know that oxygenated blood accumulates. So in hyperemia there is what? Redness is there, or we say arrhythmia. Red or arrhythmia organ. Okay, so you need to understand. Now what about the congestion? See, we know one thing, that from the organs blood comes out. Okay, blood comes out like this. Blood comes out like this, and these are the veins. Through the veins blood will come out, we know that. Okay, so veins carries the deoxygenated blood. We all know from it's too basic, we know that deoxygenated blood comes out from the veins. Okay, now if there is any kind of a venal obstruction is there inside the veins, there is obstruction. Okay, some plaque formation is there, or like some thrombus is there, embolism is there. Okay, so there is what will happen? This blood will not come out properly, it will accumulate again inside the organ. So here again, accumulation of the blood inside the organ, but which blood? Deoxygenated blood. And reason is the obstruction of veins. So accumulation of the blood inside the organ due to the venous obstruction is called as the congestion. Simple. So in congestion, as you can see, that there is what? Deoxygenated blood gets accumulated, impure blood gets accumulated. So that's the reason in congestion the organs are what? Bluish in color, bluish, or we use the word cyanosis. cyanosis. Okay, so this is the main difference between hyperemia and the congestion. Okay, now in congestion we have the congestion of the lungs, we have the congestion of the liver and the spleen. Understand one thing, that if for example this is our heart. Okay, this is our heart. We have the four chambers of the heart. We have the right atrium, we have the left atrium, we have the right ventricle, we have the left ventricle. From the left ventricle, from the left ventricle, blood goes to the organs, all the organs, from through the aorta. Okay, we know, through the aorta. Okay, through aorta. And then for example, if this is the organ, these are the organs here. Okay, and from the organs it will come back to the right atrium through the superior vena cava and inferior vena cava. In short, I'm telling you this. Okay, so now from the left atrium, if for example this is the lung here, let me use another pencil. Okay, a color. So if for example this is the lung here. Okay, this is the lung, for example. Okay, now from the lung, oxygenated blood comes inside the left atrium of the heart through the pulmonary veins. Okay, okay, from the right atrium there is the pulmonary artery that goes again to the lung for what, for purification purpose. Here the deoxygenated blood come into the lungs, and here the oxygenated blood will come into left atrium. Okay, so this is pulmonary artery. So this is the basic thing that I want to like talk about. So now understand, for example, if there is venous congestion, if there is congestion in the aorta, for example, if there is, or we can say if there is left-sided heart failure, if there is left-sided heart failure, so what it means when there is left-sided heart failure, when there is left-sided heart failure, this left ventricle can't contract. It will not contract properly. When it will not contract properly, blood will not go to the aorta. When the blood will not go to the aorta, it will accumulate here in the left ventricle. When it will accumulate here in the left ventricle, it will go back to the left atrium. When it will go back to the left atrium, that means it will come back to the lungs. So in the lungs there are pulmonary capillaries and the veins. So it gets accumulated in the pulmonary capillaries and the veins, and finally in the lungs. That's what we call as the chronic venous congestion of the lung. Here in the pulmonary capillaries, if I will talk about the chronic venous congestion of the lung. So what is chronic venous congestion of the lung? It is because of the left-sided heart failure. Left-sided heart failure. Okay, it is because of left-sided heart failure. Okay, so because of the left-sided of the heart failure, blood gets accumulated inside the lungs. Okay, or the pulmonary capillaries or the pulmonary veins. So what will happen? What will happen in the chronic that can lead to the chronic venous condition of the lungs? But now what will happen in the chronic venous condition of the lung? There is pulmonary capillaries dilation. There is dilation of the pulmonary capillaries. When there is dilation of the pulmonary capillaries, what will happen? More blood is here. More and more blood is here because capillaries are being dilated. Now more blood is here. When there is more blood or fluid, more water will be there. More water will be there. When there is more water, there will be increase in hydrostatic pressure. When there is increase in hydrostatic pressure, what will happen? Fluid will get out. Fluid will leak out. When the fluid will leak out, that's why after the pulmonary capillary dilation, there will be interstitial edema. Interstitial edema. After the interstitial edema, there will be what we call as the alveolar edema. So what I'm talking about the chronic venous congestion of the lung. Chronic venous congestion of the lung is simply because of the left-sided heart failure. In it, when the left side heart failure is there, means left side of the heart is not working properly, so blood will come back to the lungs. In the lungs there will be accumulation of the blood, so that's called as the chronic venous congestion of the lung. And then when there's accumulation in where, firstly in the pulmonary capillaries, so pulmonary capillaries dilate. When the pulmonary capillaries dilate, so more blood is there, so that will increase the hydrostatic pressure, because more blood means more water will be also there. Okay, then it can lead to the interstitial edema and finally the alveolar edema. Now there is another condition. When there is pulmonary dilation after a certain time, after a certain period or a certain point, what will happen? This pulmonary capillaries will rupture. They will rupture. Okay, they will rupture, they will burst, they will rupture. What will happen? There will be loss of what? When they will rupture, there will be, obviously blood will be leaking out. That means RBC will rupture. RBC will rupture. When the RBC will rupture, it will get converted into, it will release what? Hemoglobin. And hemoglobin will be converted what? To the hemosiderin. And now this hemosiderin is engulfed by the microphages. Okay, it's engulfed by the microphages. So hemosiderin loaded with the microphages is called as the these are called as the heart failure cells. Now this heart failure cells gives the appearance of what? Brown, I mean gives the brown appearance of the lungs. Okay, brown appearance of the lungs. So that's why in the chronic venous condition of the lungs there is brown appearance of the lungs. Okay, so these are the hallmarks. These 3 points are the hallmarks of what? Chronic venous condition of the lungs. Now we are going to talk about, we don't have that much time now, we are going to talk about now chronic venous condition of liver. Now in the chronic venous condition of the liver, okay, in the chronic venous condition of the liver, what happened? We know inside there's the structural unit inside the liver is what we call it as this, there this lobule, and in at this center of the lobule there is this central vein or the hepatic vein. What happened in the chronic venous condition of the liver? There is accumulation of the blood inside the central vein. Okay, why? Because it is seen in the right sided heart failure. Right sided, for example, if I'll take you back to the basics. See, if there is right sided heart failure, okay, right ventricles will not this right side will not contract properly. When the right side, this right ventricle will not contract properly, blood will go back to the right atrium. When the blood will go back to the right atrium, it will go to the it will go to the what? It will go back to the organs through superior vena cava and the inferior vena cava. Okay, it will be reversed. It will go back to the organs. When it will go back to the organs, there will be accumulation of the organs. It will lead to the chronic venous condition of all the organs. But most importantly, we are going to here talk about the chronic condition of the lungs. Sorry, liver. So here it is how the chronic venous condition of the liver took place. Okay, so this is the chronic venous condition of the liver. Now it's seen in the right sided heart failure. So here the central, there is blood accumulation in the central veins. When there is blood accumulation in the central veins, they dilate. These veins dilate. When these veins dilate, what will happen? They will rupture and blood will be released. And when the blood will be released, these surrounding hepatocytes or the liver cells appear red in color. Appear red in color. But the peripheral cells, okay, but the peripheral cells, they undergo fatty change. Why they undergo fatty change? Because of hypoxia. There is no blood. Okay, there's ischemia like condition. There's no blood, so they undergo fatty change. When they undergo fatty change, obviously a lot of adipose is there, so that can lead to the. That's why peripheral cells are yellow in color. So this alternate red and yellow color appearance is called as the nutmeg appearance. Nutmeg appearance. Nutmeg appearance. Okay, nutmeg appearance. Okay, so in the chronic venous condition of the liver, there is what? Again, here the liver is enlarged and there is nutmeg appearance is there. Okay, so it's seen in the right sided heart failure. Now this is now similarly chronic venous condition of the spleen. There is what? The spleen is grayish in color. Spleen is what? Grayish in color. And also there is the hyperplasia of the reticuloendothelial cells in the red pulp of what? Spleen. Okay, and some gamma bodies are present there. Okay, in the spleen when there is chronic venous condition of the spleen. Okay, now with this we are done with the hyperemia and the congestion. Okay, now we are going to talk about now about edema. Edema, sorry. Okay, edema. What is this edema? Edema is simply, it is the abnormal accumulation or the excess or accumulation of the excess fluids. Accumulation of excess fluids in where? In the interstitial spaces. What is interstitial space? Interstitial space is the space between the two cells or between the cells simply. Okay, between the cells, this space is called as the interstitial space. Okay, whenever there should be fluid present, there's no doubt about that, but when there is excess fluid in this space, that can lead to the edema. Okay, this swelling. Okay, सूजन जिसको बोलते हैं, ठीक है. So according to, sorry, this is the accumulation of the excess fluid in the interstitial space. Okay, so now what is the difference? What, there is another term called as the effusion. What is the difference between edema and effusion? Effusion is again the accumulation of the excess fluid, but it is the accumulation of excess fluid in the body cavities, like pleural effusion in the pleural cavity, pericardial effusion. Okay, so now what are the causes for the edema? Okay, causes are simply increase in hydrostatic pressure. Okay, decrease in oncotic or the osmotic pressure. Okay, mostly because of which, osmotic pressure is, which protein is responsible for it? Albumin. If there is decreased level of albumin less than 2.5 gram, okay, it can lead to the decrease in osmotic pressure. So that means there will be edema. So why it has got the, a long mechanism in it, I'll not be talking about that. Okay, because I don't have that much time. Okay, in fact we don't have that much time. Okay, so it is about, these are about the causes. Okay, these are the causes. of the edema. Okay, or edema. Okay, edema. Okay, so this is about the edema. Okay, now pitting edema, there is another non-pitting, so that is not important for us right now. Only basics we have to look up. Only, I mean, we have to focus only on the basic things right now. Okay, so now this is about the edema. Now, what about now? Very important topic that we have is the fever. Okay, see, fever is actually a response of the body. Okay, it's the response of the body. It is the defense system of our body. Here in the fever there is increase in temperature. Why there is increase in temperature? Okay, increase in temperature, I mean increase in body's core temperature. Why there is increase? For example, if there is any kind of an infection or inflammation. Okay, for example, if there is bacterial infection is there. Now bacteria enters. Okay, bacteria enters, okay, inside the human. Okay, okay, bacteria enters. Now what our body does, it increases body's core temperature. Why? The purpose of increasing this temperature is to kill this bacteria, so that this bacteria, when inside our body, when we produce more and more temperature, it will become harder for the bacteria or the in general pathogens to reproduce. That's why there is what we call it as our body's core temperature is being increased. Okay, that's why it's a symptom, it's not a disease. Okay, and it's a kind of a defense system of our body. It's a response of our body towards the bacteria or infection or the inflammation. Okay, so it's not a disease. Okay, so it is the increase now. According to Harrison, how much temperature should be increased so that we can call that fever? The definition of the fever, I must say. Okay, so the definition of the fever is the body temperature raised from like 37.7 degree Celsius. If there is increment in the temperature, like if there is temperature increases from 37.7 degrees Celsius, that then we can say it's a fever. Okay, body's core temperature, if it's more than this, then it's the we call it a fever. Okay, now what happened in the fever? What happened in the fever? See, what happened in the fever, there is actually in our body, hypothalamus is the it regulates the temperature. It is the temperature, it controls the temperature. So it is a temperature center of our body. Okay, it controls, it regulates. That's why hypothalamus is called as the thermostat. What is thermostat? When we say hypothalamus is a thermostat, we say that it regulates the body temperature. It maintains, it's a regulator which maintains the body temperature. So when I say hypothalamus is a thermometer, I mean, sorry, thermostat. Okay, I mean to say that it is a regulator which maintains the body temperature. At what temperature? 36.5 degrees Celsius to 37, okay, 0.5 degrees Celsius. Okay, at this temperature it maintains our body's core temperature. That's why it's a thermostat, it's a regulator. Okay, it regulates. Okay, now what happened in fever? Obviously there is a reset of this thermostat. Okay, thermostat set point. What does it mean, reset? Why? Because in fever there is increase in temperature. That means hypothalamus has changed its set point. For example, the set point of the hypothalamus is this. Now what hypothalamus has does, it has increased this temperature, means it has changed its set point. Why? Because it's a good thing, because we want bacteria, we want infection to get rid from that. Okay, we want bacteria to be killed. Okay, that's why it's important for in our body to raise the temperature. Okay, now what happened now? If the hypothalamus will increase the temperature, for example 38, 39 degrees Celsius, then how can we how can we like which is responsible for bringing back it to the normal at this temperature 36.5 or like 37.5, which is responsible for that? Now hypothalamus, there are another cooling mechanisms, like then we do vasodilation and the sweating. Because of this vasodilation and sweating, our body goes back to the normal, I mean at the normal temperature. Okay, now what about here hyperthermia? See, hyperthermia is the increase in body temperature. For example, 41.5 degrees, sorry, 40.5 degrees Celsius. If there's more body temperature than 40.5 degrees, then we call that hyperthermia. Now what is the difference between fever and hyperthermia? Here the thermostat set point is normal. There's no interference of the hypothalamus. See, hypothalamus, for example, if there is increase in body temperature, hypothalamus will not help you. Hypothalamus will not bring that temperature to the normal. It will not help. Why it will not help? Because the cooling mechanisms are failed here. For example, sweating, vasodilation. That's why hypothalamus cannot do anything. Okay, that's why in the in hypothermia, the main difference between fever and the hypothermia is the in the fever, the thermostat set point is being changed. Okay, reset, or reset, we can say reset of the thermostat set point. Here the thermostat set point is normal. There's no involvement of the hypothalamus in the hypothermia. It's a very important, most important difference. Okay, and here the increase in temperature is, I told you, 37.7 degrees Celsius. Here the increase in temperature is what, more than 40.5 degrees Celsius. You need to understand this. Now fever is also called as a pyrexia. We know pyrexia. Now what is hyperpyrexia? When there is high grade fever, for example fever when there is temperature, body's core temperature is 41.5 degrees Celsius. That's what we call as the hyperpyrexia. Okay, now what are the pathogenesis, pathogenesis of the fever? Before talking about the pathogenesis, I have to tell you, I should be telling you the regulation of the regulation of the fever. What is the regulation of the fever? See, on our skin we have the peripheral thermoreceptors. Peripheral thermoreceptors are simply thermoreceptors. And inside our body, we have the core receptors. See, both when there's, for example, warmness is there, coldness is there, and they will stimulate, they will both like through the afferent ways, they will take the signal to what? Hypothalamus. Both will take the signal to the hypothalamus. Thermoreceptors, whether there's cooling or there's like warmness is there. Both receptors, it depends whether, for example, if there's warmness in the external, I mean in the surrounding, this they will be stimulated. If inside, then they will be stimulated. Now in both the cases they will go to the hypothalamus. Okay, what will hypothalamus does? Through the efferent signals, the there is involvement here, there is involvement of afferent signals, here there is involvement of efferent signals. Through the efferent signals, it will stimulate the warm sensitive neuron. For example, if there is increase in temperature, okay, with respect to increase in temperature I am talking about. Okay, if there is increase in temperature, okay, then which this neurons will be stimulated? Warm sensitive neurons will be stimulated. Okay, then when they are being stimulated, what will they do? They will show the cooling, they will stimulate the cooling mechanism, like vasodilation, sweating. Okay, sweating. Okay, sweating. So okay, same goes for when there is coldness. When there is coldness, then cold neurons will be stimulated. When the cold neurons will be stimulated, they will indirectly stimulate what? They will stimulate the heating mechanisms. Okay, like vasoconstriction. Okay, vasoconstriction and shivering. So this is the regulation of the body temperature. So what is the purpose of, again, what is the purpose of like increase of I mean uh, 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 1 2 3 again, what is the purpose of increasing this temperature? What is the purpose? The purpose is simply, we our body increases the temperature because we don't want bacteria to reproduce more and more, so that they will infect us more and more. Okay, so our hypothalamus increases the temperature, I mean creates a new set point. Okay, now how can we bring this temperature back to the normal? How? By doing the cooling mechanism like vasodilation and sweating. Okay, that's why it's a different system. Okay, so this is about the regulation. Now we are going to talk about the pathogenesis. Okay, pathogenesis of what? Pathogenesis of the fever. See, I told you there are three mechanisms of the fever. There are three mechanisms of the fever. One is the pyrogens. Pyrogens are responsible for it. What are pyrogens? Pyrogens are the chemicals or the substances which cause fever, which initiate fever, which start fever. Like we have the exogenous pyrogens, we have endogenous pyrogens. Okay, in the exogenous we have like bacterial toxins, viral production, drugs. Okay, like allopurinol. Okay, in the endogenous we have, what we have in the endogenous, like we have the cytokines, very important, most important cytokines like interleukin 1, interleukin 6. Okay, interferon, gamma interferon beta. Okay, tumor necrotic factor alpha. Okay, all these, and we have the prostaglandins, mostly prostaglandin E2. Okay, these are the type of the pyrogens as well. So these cause what? Fever. Another, when there is what? When heat production is more, than heat loss, like in case of malignant hypothermia. Similarly, when there is what? When there is dysfunction, of or regulation, dysregulation, or improper regulation of the heat mechanisms. When I mean when, like in case of the heat stroke, our body is not able to lose heat. Okay, that's the dysfunction of this heat mechanism. Okay, so these are the mechanisms of fever, how these things can lead to the fever. Okay, now what will happen, for example, if pyrogens are there and this mechanism is there and this mechanism is there. Okay, so now what will happen? Okay, now what will happen, for example, if pyrogens enter inside our body, they will release the endotoxins or endogenous pyrogens. I mean, they will release what? Cytokines. Cytokines will be are being released from the immune cells. Okay, like interleukin 1 and 6. Okay, interferon gamma beta. Okay, they will be released, and when they will release through the bloodstream, they will go to the hypothalamus, and hypothalamus will be stimulated, and they release prostaglandin E2. When the prostaglandin E2 will be released, what will happen? They will stimulate what? They will reset what? Thermostat set point. Thermostat set point. Okay, this is how then the temperature is being increased. This is how in fever temperature is being increased with the help of this prostaglandin E2. And why there is overproduction of the prostaglandin E2? I told you, because of this pyrogens. Pyrogen is makes the release of cytokines, and cytokines will stimulate the production of the PGE2, and then they will reset the thermostat set point. Okay, so this is about the fever. Okay, now we are going to talk about now the rheumatic fever. Rheumatic fever. See, what is this rheumatic fever? When there is, like, it is an actually autoimmune response associated with the streptococcal infection, but not the bacteria. For example, it's actually the child disease. It's actually a child disease. For example, if someone is having, for example, he must have having tonsils. Okay. For example, if there is infection, for example, with the help of gas means group A streptococcus. For example, group A streptococcus bacteria infects the tonsils, so there will be tonsillitis will be there, tonsillitis or pharyngitis. Okay, tonsillitis. So actually on the surface of this this bacteria or this gas bacteria, there is one antigen present called as the M protein. Okay, M protein. See, M protein. So here, when they will attack or go to the near the tonsils, they'll on their surfaces there will be M protein present. M protein. So what will happen? Our defense system will get stimulated. Inside our body, what will happen? The antibodies will form, and these antibodies will react with this antigen, form the antigen antibody complex, and this bacteria will get killed. Uh, uh, so uh, uh, so we are done with this, na? I mean, with this infection. But the problem is M protein, this antigen is also present in the 5 organs, like in the brain, in heart, okay, skin, okay, subcutaneous tissue, and then joints. This M protein is present also there. M protein, M protein, M protein, M protein, and M protein. Now what will happen? These antibodies will get confused. They are like, bacteria is still there. Okay, bacteria is still there, so we have to, they are like, these antigens are also bacterias, so we have to kill them. Now what happened? They already killed the bacteria, but again they think bacteria is still there, so they go and make the complexes and causes what? Damage to these organs, causes damage to these 5 organs. Okay, so what is now rheumatic fever? It is the autoimmune uh, uh, response. Why it is the autoimmune response? See, because of these antibodies. Okay, because of these antibodies, the autoimmune response. Okay, uh, which causes damage to the 5 organs, which causes damage to the 5 organs. Why it's not caused by the bacteria? See, bacteria is being killed. You can see bacteria is being killed by the antibodies. Now antibodies of our own causes this damage to these organs. That's why there is no involvement of bacteria in the rheumatic fever. There is involvement of the antibodies of our own. That's why we said that it's the autoimmune response. Our own antibodies kills the organs or damages the organs. That's why it is an autoimmune response. Why? Because bacteria is already being killed now. So our own antibodies kill these, damage these organs, these 5 organs. So here in the brain, we called it what? Sydenham's chorea. In heart, it's the rheumatic heart disease. Okay, and in skin, it is what? In skin, it is erythema, erythema, erythema marginatum. Okay, erythema marginatum. Okay, in there's subcutaneous nodules, means like painless lumps are there under the skin. And joints is what arthritis means, I should say polyarthritis means what inflammation at the joints. Okay, now there are two important categories. We have the Jones criteria, we have the revised Jones criteria. I think they will take more time, and I think this is not the right time to discuss that. Okay, inshallah, I'll be talking about in the next time. So we have the two criteria that you should know. Only I'll write the names, I'll not go into it. Jones criteria, and then we have the revised Jones criteria. Here we have the major criteria, minor criteria, major criteria 5, minor criteria 5. Again, here major criteria 5, minor criteria 4, and we have the gas criteria. Okay, so I'll not go into this. And last, what we have, rheumatic heart disease. In the rheumatic heart disease, what is the rheumatic heart disease? It is the damage or the permanent damage to the heart valves. It can lead to the scarring of the heart, deformity of the heart valves. Which valves? Mitral valve, tricuspid valve, pulmonary valve. Okay, okay, so aortic valve. And what will happen, there will be stenosis will be there, and regurgitation will be there. Stenosis, the valves will not open properly. Regurgitation, it will not close properly. Now there will be there, it can lead to the many diseases like left ventricular hypertrophy, and like hypoxia, other things. So many complications will be there. Okay, so it can lead to the heart failure finally. Okay, so this is about the rheumatic heart disease. Actually, why they, what is the cause of the rheumatic heart disease? The rheumatic fever. Okay, these all disease like Sandenham's chorea, okay, erythema marginatum, subcutaneous nodules, arthritis. These are all because of what we call is the rheumatic fever. Rheumatic fever, because of the many various episodes of the rheumatic fever, when someone is getting rheumatic fever again and again, again and again. Okay, that can lead to these 5 days. One of the diseases, the rheumatic heart disease. So rheumatic heart disease is because of the rheumatic fever. What rheumatic fever is because of the autoimmune, I mean, of our like own antibodies. Rheumatic fever is because of our own antibodies. Okay, so these important points you have to, I mean, keep in your mind. So with this, we have, I think, finished all these topics that I mentioned earlier. Okay, thank you so much.